take the filter out and you need to check it for no holes. If there's holes in here on that filter, it's no good, you have to get a new tray, okay? If there's no filter in here at all, you need to get a new tray. So there's lots of different, points that you should check when you're opening your instrument trays. So there will be some locks on the outside of here. They're either gonna be white or orange or green. There's different colors. It's gonna turn, so you need to check locks. Make sure that there's locks on each side. If there's no locks, it's not good. And then you're gonna look down. I'm gonna see, do I see an indicator? I see an indicator. You need to know, you're gonna have to figure out what colors should the indicators turn. Are the indicators blue, are they pink, are they orange, are they black? Everything will turn from one color to the next once it's been sterilized, okay? All that's good, that's good. So my instrument tray is open. So now it's open and ready for me to be able to come back in and grab it sterilely to place it on my back table. So once I've done that, I'm not moving it, I'm leaving it here, I'm moving on to the next step. I can't open my ring stand, right? So we know it would be back table, ring stand, instruments, then mail. But I can't do my ring stand because why?
Sterile.
Right, so I have to leave that until once, and then I can do it once I become sterile. So now I'm gonna go over, I've done everything, I've opened everything I can open while I'm non-sterile. So I'm gonna open my gown and my gloves, right? So, check, good. So I try to keep everything fairly close together. Like you remember, she said you're not gonna have a lot of space in the OR, so you're not gonna be able to be real spread out, okay? And what's something that I forgot to get?
Oh, no.
Trash can.
Oh, yeah.
So I'm in that trash can. So you always wanna have a trash can because when you're opening stuff, let's say you're opening a bunch of extra sutures and things like that, you're gonna need a trash can to put the trash in. Some places they'll have you save the packaging because that's how they charge. They get the numbers off of that and they put it on the charge sheet. So once you get to your designated facility, they'll tell you, what the preference is. But you need to have a trash can. So I open my gown. Now watch me drop my gloves on the floor. But it's okay, if that happens, you're just gonna go and get another pair, okay?
Would the circulator get it or would we get it?
So at this point, I can go get my own gloves. So
Okay.
usually for me, I grab 2 pairs, cause if I
Okay.
drop them, I already got an extra pair in my pocket and I can just go ahead and get them, throw the other
Okay.
one away. I usually grab 2 pair.
Okay.
Some people you're gonna see, they're gonna grab 10 pair because they know they're gonna be in that room all day. So
Okay.
they've got gloves all day for the whole entire day.
So how do you know when you need to double glove?
You always double.
Oh, so always double glove? Okay.
So, I'm gonna go. Okay, I'm scrubbed, right? Okay, so I'm here, right? I'm coming in the room. So yeah, we'll teach you how to double glove. Right now, we're just trying to get the first pair of gloves on.
Okay.
But eventually, like for all your cases, you want to double glove because you want to have that indicator glove on. Remember?
Yeah.
So you can see like if you get stuck or if there's a hole in your glove or whatever. So best practice is to double glove.
Okay.
So I'm gonna grab this, right, right here, I'm drying, and I'm not wet, so of course this is probably not the best way. So here, and again, there's no right or wrong way, just make sure your hand is covered up and you're using the opposite side, right? So I'm going down, 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 dry. Gonna come over here, gonna grab, turn. Somebody want to time me? If you don't have anybody, you can keep working your hands or whatever in, but you should always have somebody because you'll have a preceptor with you, okay? You're not gonna move till she tells us. Okay. Go up here. what am I missing on my face?
Eyeliner.
I didn't have any, so pretend I got some eyewear on. I'm gonna grab this glove, step back. Y'all have to. So mine just stuck, right? So this is all I got to work with, so I'm about to let it go. All right, this is what I got. Came out, so that's a no-no.
If your fingers pop out for a second, do you have to re-scrub or like re-gown?
Yes.
Yeah, okay.
I wanna tell you yes, but you're gonna see sometimes people, they're not going to.
Okay.
Anybody? Alright. So I'm gonna leave that just for a second, so if anything happens and I contaminate or my glove gets a hole in it or something like that, my nurse or whoever could come and open me up some more gloves and I can proceed to go ahead and gown and glove off off my Mayo stand again, okay? So now I have this, my ring. Ring it here. Now I'm being very careful of where I'm placing my hands and everything because now I'm sterile, correct? This is not sterile, so I don't wanna be bumping up against anything. So all of this is sterile, so I can just open this up.
And that's called your basin?
Yes. Okay. So all of this is sterile, right? Blue to blue, I'm sliding this here, okay? So for me, I don't know how Professor Lavender did it, but I always try to put towels down just because it gives me a little bit more protection. You don't have to do it this way, this is just my personal preference.
What do you mean protection?
So like when I put my, my instruments up here, they're kinda heavy, so if you put them down and it pops a hole in it, this just gives me a little bit more protection on my back table. So I'm gonna ask my circulator, Allie's my circulator, hey, can you clean off that Mayo stem for me, please? Alright, so we know left hand goes here. Once you get your left hand in here, I always just kind of lift it up and grab the inside, because you can't just slide your hands in here and not grab the pieces on the inside, or it's all gonna flop over and you're gonna contaminate, okay? So I grab the inside, got this, I'm just sliding this on here, put my foot here. Just gonna work this Mayo stand on here. I'm keeping my hands in here the whole time. I'm not coming out, touching this piece, pulling it. I'm keeping my hands on the inside, okay? My foot is on here so this doesn't slide around. So I'm just working it. Then I'm gonna grab this piece. Now I can touch all of this, correct?
Yes.
So I always grab this just so it's not hanging down, flopping down at the bottom. I'm gonna grab this. That's my Mayo, right? If it was kind of pulled up at the back, the nurse could come down and pull it down for me if she needed to. So I'm gonna slide the Mayo here. Up into the tray. And like Professor Rhonda Green will tell you, neatness is everything in the OR. So you wanna be neat and you wanna be organized.
And so just an extra towel that's on top of it, that,
So this Mayo has a foam.
oh,
It's foam piece. Some of them will have foam, some of them will not. It doesn't matter either way. So this one has foam, but I'm still gonna put a towel on top. So I'm gonna slide this over, cause why? It's blue to blue, right? Everything in here is sterile now.
Would you pull this side down more, or is that good?
I
How far?
can't pull that side down.
Well, like the nurse,
The
would you
nurse
have
can
her?
pull, yeah. But
Okay.
everything, so remember, all that down there, that's not sterile for me anyway.
Okay.
So I'm not worried about it. So
Okay.
if the nurse wants to come by and pull it, she can. If
But it's not a requirement
Yeah,
to
it's
have
not a
her, okay.
So, my Mayo, right? So all of this now is complete. So, We got our small bowl. So this pack was already previously used. Most of all your stuff will be on a tray, on a little white tray, and it'll be sitting inside, but they already used it, so they put everything back in the bowl and wrapped it up that way, which is fine. So we got Bovie holster,
Question.
Bovie pen,
Thank you.
okay? This piece comes off, right? So this would be part of your count, so this Bovie tip.
So it's 3 pieces.
Yeah, but you're gonna just count the tip for your circulating nurse.
Oh, okay.
But you always wanna make sure you're aware of where this is at, because this was the piece that Professor Green was talking about. It was the noise. She heard a beeping noise, she didn't know what it was. This was laying down beside her and it was burning her. So you don't want this laying on your patient, cause it will burn your patient as well. If the doctor's pressing it, and you're like, what is that? This could be burning your patient, okay?
That's the holder and the Bovie, right?
The Bovie holster and the Bovie pen.
Okay.
With tip.
Okay.
We have that. We've got, what are these? Lap sponges. So laps come in 5. These are Raytex. Raytex come in 10. The blue pieces on them are X-rayable. So anytime you have any type of sponges, you always wanna make sure you pull out these strings. So laps are gonna come in 5, right?
Yes.
So 1, 2, 3, 4, 5. 1, and the string, right? I need to see these present, because if these aren't present and this gets left in a patient, how can you get X-ray to detect it if it's still left in there? You can't, right? So 1, 2, 3, 4, 5. Okay. We got Raytex. Your stuff should be in a little bit better order than this, but this has been used multiple times, so. So we got Raytex. 10, should be 10 Raytex. If your counts are off, so if I've counted these 5,000 times and I'm like, there's only 8 in the pack, I'm going to pass them off to my circulator. My circulator is gonna take them off on my field, tie them up in a bag, and these are not gonna be included in my count. It has to be 5 and it has to be 10. You don't wanna start with an off count, you're automatically thinking they're supposed to be 10 and 5. Now you only start out with 8. So if the count is incorrect from the manufacturer, take them off, get new ones, and the count needs to be 10 or 5, okay?
Does the Raytex have the string on it too?
So the Raytex have the blue piece going down the middle.
Okay.
Can you see that?
And that's X-rayable?
Yes.
Okay.
So this one's gonna be for like, if you have a small little hernia case where it's just a small incision. This one's gonna be for if I have a big abdominal open case and I need a big sponge. So you'll have to figure out which sponge you need based off the type of surgery you're doing. Some surgeons may always want 1 lap sponge, so you're gonna put a sponge on your Mayo to always pass off. Doctor preference, whatever, but it's gonna be either based off the types of surgeries that you're doing, okay? So we've got 10 Raytex or 32 ply. It could be called either one. So you'll see them on count sheets as either one, Raytex or 32 ply.
One?
So I've got 10 of these. I'm always gonna completely separate. I wanna grab them by the back, right? So this is the back. See how I can fan them out? You don't wanna turn by this side, 'cause then when you're trying to separate them, it's gonna be hard. So I've got 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay?
If there was 11, would we take one out or
You
the
would take the whole pack
whole
out.
thing out? Okay.
So the manufacturer they may have made a mistake, they do. So if your pack, when you initially open that pack and it's not correct, I just throw the whole thing off and say, hey, can you open me a new package of Raytex?
Okay.
All right? We got got medicine cups, right? So. Maybe, maybe not. Alright, there we go. So they have a small one. And we have a bigger one, okay? So anytime you have any type of solutions, anything being poured on your field, you're automatically gonna label whatever they're putting in the medicine cup, okay? You may have a specimen, can go in either of these. So I always just put them to the back, towards my back, so that way I can have it, so if my nurse needs to come and pour me some lidocaine or whatever she can just stand here and then she can squirt it to the back. If she can't reach it, I'll stand out and I'll hand it here so she can put it in my cup. But as soon as you get any type of solutions or anything on your field, you need to label them. They always need to be labeled. So these are light handles. So these are the green ones. So those handles up there, the inside of that, that's what this is gonna slide onto. So this is how you handle. So now, you know this is sterile, right? You got it out of your sterile pack. So this is gonna go on your light handle. This is the only piece I can handle now. The surgeon may ask you, hey, move that light over here. So I'm gonna slide this on there before my case starts, and this is the piece I'm not touching anything else but this green light handle, okay?
Do we put it on right as soon as we open it, or do we put it on the back
So
table
you
first?
couldn't put this on there until what?
The patient,
The patient is straight.
okay.
So I can't walk, if I'm sterile and patient's still there, and they haven't draped or done anything, I can't come up to this patient and do anything on this patient until this patient has been draped. So always remember, you have to be blue, okay? So for me, these would be something that I would put on my mail, because I know I'm gonna need to put, so if I only have one light handle, one light source, I'm only gonna have one on there. If I have two, I'm gonna put both of them on there. You may not need them, you may not use them, but it's always better to be prepared than be in the middle of the case and your doctor say, hey, I need you to move the light, and your light handles are still sitting here on the back, okay? So we have suction tubing, right? And then an oral disposable suction tip. Okay?
It was called, what, I'm sorry?
Oral, O-R-A-L, suction tip, and this one is disposable. So I'll show you the difference between this one and that one. Of course, that one in the tray is reposable or reusable, and this one is disposable. So you'll have that. So we got a ruler, and then we have a marking pen. Black side, permanent. Black side is what I'm gonna use to open up and write on here, write on my labels, all of that good stuff. Blue side is for the doctor to mark on the patient's skin. Blue side's gonna come off, okay? So I got a blade holder. So this would be what my knife handle and all this stuff. Once I put my blade on it, I would just sit my knife handle in here, and then this is safe. Now I'm gonna put it face down to where the blade's facing in here, so if I have to reach back on my table, I know I'm not gonna cut myself with the blade. So that would sit right here. Okay, so there's a blade in here already, but this is a needle board or a needle counter. You can call it either one. So you see how this side over here is magnetic. So once you sit stuff down on there, it's gonna stick to it. So you need to be careful when you're putting, suture or anything in here, because this side over here is magnetic. And this is the needle counter, or suture counter, needle counter, to where you would stick your suture in these spots. So I stick one in one, the next one in two. So by the time I get down here, I know I've got 10 suture, and I just keep one. You have some that are really big that have up to like 40, I think, because they use a lot of suture on some cases.
So do we just like poke the suture into it? Is that how that works?
Mm-hmm.
Okay.
If I had one, I'd show you, but I don't. So yeah, so basically, you take this piece off.
Oh, it's foamy.
Oh,
Yeah.
okay.
So you take this piece off, I'm not gonna take it off, but you pull this off, and you stick it in here, right?
Uh-huh.
And this is foam. So you would stick the sharp piece inside here, and this is how you would keep track of. So when it's time for you to count, you could say I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You know what I mean? This is this. Then on the back of this, most of the time they'll have adhesive pieces that you can pull off as well, and you stick it here. So this is not going anywhere. Okay, so that's there. What is this? This is an asepto. AESPTO, something like that. Asepto. So look it up in your books. It should be in your book. So this is where you would have, you know, some saline water here. My doctor wants saline water here. So this is gonna go in here.
So that's how you get the saline out?
Yes. This is a suture bag. Okay. It tells you on the front, suture bag. So this would go over here on the corner. You pull this off and you stick it here. This would be where you put sterile trash, right? Packages, stuff like that. You're gonna slide it in here. You're not gonna be sticking your hand all the way in the bottom because why? This piece is down here, so you're gonna have it here, stick it here, and you're just gonna slide things in here. Okay? So that would be hanging right here. I don't wanna pull this stuff off because, you know, you could use this, but. Boom, right there, all right? Okay. This is an Emerson basin. Most people call it a kidney basin, is the other name, but it's an Emerson basin.
Can we call it kidney basin? That's okay?
Well, for the test,
But the test you want Emerson.
Imogen?
EMESIN, I believe, no, actually,
It's not.
Emesis.
Emerson basin.
Oh, as in like throwing up?
Yeah.
Emesis, okay,
Oh.
okay.
So, gonna have this, right? So for the test, I'm not gonna say, you can put both, but like she said, you want the name that's in the book. You wanna know the names that are in the books. These are gonna be your labels. So everything that comes on your back table, you need to label. You need to label it as soon as it's poured or as soon as the nurse gives it to you, you need to be labeling. Because if I've got 3 clear things back here and I forgot to label, now how do I know what is what? So as soon as it's passed off to you onto your sterile field, you need to be labeling. You need to see the name and you need to see the expiration date. You need to verify both of those things with your circulating nurse, okay? Alright, what else? Then over here, of course, you've got your basin. This is sterile. All this sterile. Okay, because it came in my pack, right? Then I have towels. Alright, so we're gonna go back through this, and I want everybody to tell me what the items are. So we'll start with you.
Laps.
Lap sponges?
Laps.
How many?
5. Raytex.
10.
Okay, or
32 ply.
Or what?
32 ply.
Oh.
Light covers.
Light cover.
Light handles.
Handles. Light handles. Suction. Disposable oral. Suction.
Y'all gotta speak up. Y'all all sound all scared.
Suture bag. Bovie holster.
Holster.
Bovie and
With the tip.
Bovie kind of tip.
Good. Needle board. Needle, yep, needle board, needle holder.
Needle board. Blade holder.
Yep, blade holder.
Asepto.
There you go.
So this is a small, I just call it a small basin. Small basin. Basin is a better word for it. Small basin.
Label.
labels,
Sterile
pen,
medicine.
Marking
Marker.
Marking pen.
marking pen,
So what's the black side?
The label.
Permanent.
Permanent side.
Is the one that don't.
Not
fit.
permanent.
Ruler.
ruler, Emesis pen.
Small.
Medicine cups,
Medicine cups.
Smith specimen cups,
Specimen
specimen cups,
So you want it to be specimen, not medicine?
specimen cups.
Specimen.
There is a medicine cup. This is a medicine cup.
Oh, the smaller
This
one.
is a specimen
This is
cup.
a specimen.
Okay.
Medicine, specimen,
Specimen.
right?
Go back and rewrite this.
It's only 10 o'clock. It seems so much later. What'd you say?
We should act like.
We can pretend.
So for me, I always put, Professor Lavender can correct me, but I always put, so say I'm doing a smaller case, I put a couple Ratex, maybe 2 or 4, I always try to put even numbers, so I always try to do 2, 4, 6, try to do even numbers. I would put, I got one light, so I'm gonna put my light handle cover up here, cause I know I'm gonna need that. Anything that I know I'm not gonna need, so like this would be trash, so I would stick this in my sterile trash, okay? So you always wanna keep this organized and clean, you wanna keep it organized and clean, so when if you have to come back here, you know where everything is sitting. For these, I would stick these up here.
So the extra towels, we don't use the extra
Or you're
towels?
gonna use them to gown and glove your surgeon.
Oh,
Or
okay.
you're gonna use them to, drape.
You only give him a real towel. He doesn't get the paper towels like we do.
Okay, so he uses those.
So he
You
doesn't
have
use,
to, may I show them? We're getting a little ahead of ourselves. Hold on, wait. Tatiana, hold your hand out. So when you give this to him, you don't put your hand down though. You don't do this. Because this is what's gonna be happening. He's gonna be, oh yeah, man, I know, and I saw that, blah, blah, blah. You have to let him know you're there because 90% of the time he won't be looking at you. So you have to put it in his hand so he'll, oh, shoot, she's there. Okay, so when we get to that part.
You do that, Mark?
Yes, I sure do. I let them know, hey, I'm here. I sure do, because they're not gonna be tensed up.
Yeah.
So when I put that in their hand, because they're not looking at you most of the time, if there's somebody else in there, a rep or whatever, they're talking to them, so they're not paying, their hands are out like this, but they're not looking. And if I gently lay that in their hand, they're not gonna know it's there. Or they're gonna move and it's gonna fall on the floor and he's gonna look at you like, really? So you put it in their hand, so they know, okay, she's there, and then they'll start drying.
so basically, always what you wanna do is you wanna build, so now would have towels, drapes, all this stuff over here on this corner, right? That's my corner for the stuff I'm gonna be using, cause I'm setting up for, to slide my back table to the bed. Over here, I would have, let me make sure I'm doing this right. I would have my towel on top for my surgeon, right? Then I would have his gown, then I would have his gloves, right? Then I would have the drape, then I'd have some more towels.
You have the towels.
Towels and the drape, yeah. So you wanna build everything over here, the way you're gonna pass it off.
So it's in order.
So it's in order, so I can
You
just
don't have
come
to dig.
here and I can just, okay, we're gonna give him his towel, we're gonna put his gown, give him his gloves, then we're gonna do towels, then we're gonna do drape, right? So I'm gonna build so everything over here is for me to be in order. So it's already, I'm ready to go. Nobody's waiting on me, I've already folded my towels for my draping, all that stuff, it's right here. Alright, now I got my major tray. Where I think it's a major tray. So I got a major tray, so I had already opened this previously, correct? I already had it open, I see my indicators, so you see I'm not all like this, I'm standing back here, hands are here, I can see, I'm gonna ask my circulator, hey, can you come verify to see that it's an indicator in here?
I'm busy.
Oh,
I'm
okay.
I see the indicator.
Okay, so when she says yes. So I'm gonna pick this up from the inside. I'm not coming here grabbing this, I'm gonna pick it up from the inside. Right? I'm gonna hold this here.
Sometimes there won't be one in here, but it's our job to look, okay? If there was, she's gonna stay there and I'm gonna take it out, I'm gonna hold it up and make sure there's no holes in it. You're good.
All right, now I'm coming over, gonna sit this here on my back table. So rule of thumb, I know I've heard Professor Green say this, once you sit something down, you don't want a bunch of movement. Wherever you're gonna put it, you wanna sit it there and leave it there, okay? You wanna move everything one time. So now, so you're gonna make a roll for your instrument.
So you see we do that different, right?
Oh, yeah, most people do.
Yeah.
Which way do you roll it? This way?
I don't unfold it at all. I'm in all the way. I leave it like this, and if I need a long one, I just make my crease and roll so it's thick. And then if I need a short one, I just turn it this way and roll it, yeah.
So, again,
It's just preference. There's no wrong way. So she's gonna teach you a way, I'll teach you a way, and you're gonna use whichever way works for you.
So we need to have two rolled up ones, one for the Mayo stand and one for the back table, or just?
I only do one for my back table. I just lay my instruments flat, but
Okay.
preference.
It is total same thing. See, I have to have everything in line and in order and standing up. Now, if I was doing a case and I only needed 5 instruments, like if I was doing a tonsillectomy, I would not use a roll towel. I would lay those 5 instruments up there. But if I'm using a bunch of instruments, I don't wanna stack them on top of each other, cause what's gonna happen is they're gonna slide off and I'm gonna have a big mess. So that's why I personally use the roll towel. And again, it's gonna be your personal preference on what works for you.
Yep. So at this point, you're ready to start setting up and start counting with your circulator. So, like she's saying, you know, there's no right or wrong way. When you get into the clinical site, you're gonna see 1,000 different setups, 1,000 people are gonna do it 1,000 different ways, whatever is most comfortable for you. You just need to know the basic pieces of how to open it up, how to set this part up. Once you get down the line, you can figure out if you wanna use a roll towel on your nail, if you do not, if you do, that's up to you, okay? We're just teaching you the basic pieces right now. How to open, gown and glove correctly, things like that. What everything is named, that, like, right now, that needs to be the main thing, you know what all this stuff back here is called. Okay, for me, I kinda just sit all my tissue forceps up here, but again, personal preference, that's just for me. I know these instruments pretty good, so it's not hard for me to set it up and be like, oh, I know this is this and that is that, so. You always gonna need a knife handle, right? How do they make an incision without a knife handle? So you know that would be stuff that's gonna go on your Mayo stand, okay? Then you would count. And I don't know, we're probably not gonna count today, but I'm just showing you, like, after this step, you know, you got everything set up, now you're ready to say, okay, nurse, I'm ready to start counting. You count everything with her, and then you'd be ready to throw off stuff to your Mayo stand. You can put stuff that you don't think you're gonna need, so if this is an open case, and I don't think I'm gonna need some stuff, and there's some extra little pieces, you can put them here. Cause I can always go back in here. If I'm not comfortable yet, and I don't feel like I have enough space to do what I need to do, I can always put it in my ring basin, okay? If
What
I need
usually-
it, I can come back and get it, because why? This is sterile.
So once while we're here, are going to teach you how to do it in the book, period. Okay? When you get into the field, when I'm in the field, I put my Yankauer and my tubing and all of that stuff, the Bovie, the light handles, and my drapes, everything's right here. And I put it in order. So it would be towels, drape, and then all the stuff. Because that way, once I pass off the patient, or drape out the patient, I can just push that up there, and they can do it. Okay, if I'm still setting up, because you never know what's going on. I may still need to count, so I can't move up, so I can push that up. And my dressings, I always pick this up and put my dressings right here and put it back down. Cause this is sterile, right? That way I don't have to worry about them getting blood on them and getting nasty. But that's all down the road and later.
So right now, the main part we wanna focus on,
I didn't see it yesterday either.
so right now, we just wanna make sure we all know, what all this stuff is. So we're gonna go through this stuff again. Asepto.
Asepto.
I want y'all to call it out, I know what it is.
Asepto.
Okay,
Small basin. Ruler and marking pen. Labels.
alright, and sometimes you'll see these, they'll be pre-filled already, sometimes they won't. It depends on where you're at and how they have their packs made or whatever. So sometimes it'll already have NaCl on there and stuff like that, it'll already have some names on, some generic names on here. But if not, you're gonna use that black side, you're gonna fill it in, the name of it or the abbreviation for it, and then the expiration date, okay?
Emesis basin. Medicine cup. Specimen cup. Ratex.
Alright, how many?
10. Lap. Sponge. 5. Blade holder. Suction tubing. Oral.
Yep, so, okay, here we go. Disposable. Reusable. This is the one you're gonna make sure you have the two pieces. So I have the suction and I have a tip. Okay? Like she said, sometimes these are soldered on there to where they don't come off, sometimes they do. So it's always your responsibility to make sure. Before I pass this off, I wanna make sure this is on secure. Cause you don't want it coming off during your surgery, but you need to know that there's 1, 2, okay? So we got all that.
Light handle. Bovie holster. Bovie pen with tip.
So that's pretty much what you're gonna see in the pack. So these are what we were talking about when we say chemical indicators. So these are blue, right? So it tells you on here, blue bar changes to pink when exposed. Oh, these are actually for Sterad. You're gonna see steam ones in these kind of trays. So the objective is, this strip will turn from one color to another. And on any indicator you ever see, it's gonna tell you specifically. It'll even have a picture sometimes, the color. It has to at least reach that color for it to be sterilized, okay? So this is gonna be one of the things you're gonna be looking for in your tray. Cause if you and the nurse can't see this, or y'all can't find an indicator in there, you cannot use the tray, it's not sterile. So remember, sterility is absolute. It either is or it isn't. So say I had a missing lock. I had one on one side, but the other lock was missing. It's no good. It's either it is or it isn't. It's absolute, right? So you're gonna have about 5 checkpoints before you actually get to this. So if one piece turns colors and the other one doesn't, can't use it. Everything has to be on one accord, or you throw it out and you start over and get new, okay?
So there should always be 2 filters?
Sometimes there is, sometimes there isn't.
So you got 10 or 12 different types of
If
containers.
it's got holes in it, there should be a filter in it. If it's like, pretend this isn't here, and it's like this, then you know that there's not a filter in the bottom. But if it has holes in it, there should be a filter.
And most of the time, your filters are gonna you're gonna check for holes, and you're gonna check for the dot on it to turn colors. So that's why I'm saying there's gonna be 5 different checkpoints before you actually get to the actual tray to put it on your sterile field. And it is up to you as a tech to make sure all 5 points pass that assessment piece, right? You're assessing this tray before you put it on your back table.
They accidentally got thrown away yesterday.
Oh.
But this one, remember the blue deal that Professor Malone took off of here? That would actually be in between these, not on top of it, tape. it would be in between these, so you'd have to unlock it, take this off, and then pull that out and hold it up to the light.
And we do this before we even.
You won't be doing that.
Oh, we won't.
Yes, you will. You can, no, you'll be scrubbed in.
Yeah.
No, you'll
The
open
top
your
one you
instruments,
can.
you'll open your instruments
Okay.
before you scrub in.
Yeah, okay,
So you do this one.
okay,
Wherever's in here, you can't do.
okay.
But there were always, if there's holes in the case, in real life, there should always be
Yes.
a filter
Yes.
at the bottom.
Yes.
Yes.
Anytime there's an open space for any type of, that's called a retention plate, which you was just holding to. Anytime there's a retention plate, it should be a filter. So if you walk up and there's no filter, or say the filter plate or the retention plate fell down, now the filter's sitting inside the tray. It's not good. You can't use it. So it should always be a filter if there is a tray that has holes at the top and at the bottom. And sometimes you'll have where it's a filter only at the top. Sometimes it'll be on both. Sometimes you won't have any at all. So, just have to pay attention to the brand of the container you're using, and then the containers use different locks. So, like I said, some are white, some are orange, some are pink. And we'll go, later on, you'll see, you'll get a better idea of that, but any questions over any of this?
I have another one. So let's say we're scrubbed in and recirculator checks the second filter and it's not good, does she go get?
She would have to,
You
because you're
say
scrubbing.
you're gonna hand those off and you're gonna have to redo your whole back table and make it sterile again. The way that you do that is cover it up with sterile towels.
So that's why I was here holding this. Because I'm waiting for her to give me confirmation and say, yes, it's good, or no, it's not good. Because if I just go ahead and sit over here and she say, oh, no, that's not, it didn't have a filter at the bottom. Now I just contaminated. So that's why you always wanna say, am I good? I'm like looking at her, yes, okay,
Yes, you good.
you know,
So if it wasn't good and you're holding it right there, are you
I'm
have to-
contaminated.
If you're holding it out
Mhm.
and not up against your body, the only thing you have to change is your gloves. But
Okay.
if you've got it sitting on your, chest,
Mhm.
yeah, you're gonna have to change everything.
And sometimes you're not gonna be able to hold it out.
Yeah,
Some of
'cause
those
they're gonna be
trays are
heavy.
So you gotta protect, I'd rather just have to change all this than be trying to throw my shoulders out, because some
Yeah.
of those trays are 28, 30 pounds, and
Yeah, and you can't do this. You'd be going,
hurry up! Yeah, so you're right, so if I was holding it, like she said, Professor Lavender said, if I was holding it here, I'm just gonna
Change the gloves.
change these. If I'm holding it up here, then I gotta change all this, but I'd rather just do this piece than have to do all of this.
So would you have to change everything or just the towels that it touched? Like, can we take the towels off and then leave the glue drape, or take off everything? If that makes sense.
okay, so like if I had sat this down and then you came in and
Okay.
said, this is bad.
Yeah. Do we
I
just
would
change the
remove
towel?
this and I would remove everything that it was touching.
Okay.
So it wasn't over here, but the way that the towels are laid, because they're long ways,
Uh-huh.
then yeah, you'd have to remove, just cover them up.
Okay.
So
So
I
I
would
would
remove
fix
these.
everything, just the part where it touched.
Would it be ideal to just change everything? Like, would that,
No,
no?
It's expensive and that
So
patient
this
is the
costs
one that
money.
has to pay for it.
everything back here costs some money. So
Gotcha.
you have to think, if we're wasting or contaminating or anything, that's going towards the patient's bill. So you wanna be as efficient as you possibly can, because you don't wanna be costing a patient additional money.
And I look at my detailed billing
Mhm.
and I have seen where there was, 2 of this open and 2, because I'm in the field, I'm like, why are they open 2? Oh, I know why.
Contaminated.
Mhm.
And I know where I work, in techs that have those problems who constantly contaminate, it goes towards their evals. Because the objective is, provide quality patient care, but you also wanna be efficient, you wanna keep your cost per case down. So they do all these crazy audits and stuff like that, but techs who have problems, cause they're always contaminating, your eval's not gonna do that great. Cause they're gonna start dinging you because you're costing their patients more money. In some of these cases, delay, you contaminate an instrument tray, but they only have one. So what do you do now? They have to go through the whole process, so now your patient's on the table and you're waiting for a tray because you contaminated. Okay, So, I'll let y'all kinda come back here